Hello there, psychology students, and welcome back. Today's topic is psychology as opposed to psychiatry, two fields that are related to each other but not identical. From earlier in the course, you've heard me define psychology as the science of mind and behavior. Of course, some psychologists provide therapy, but right now what we're doing is we're just defining the fields. Taking a look at psychiatry, we see that what it is a medical specialty that's dedicated to the treatment of mental illness. Of these two, you can see that psychiatry is the more narrow of the two. Let's take a look at the background and training for folks who go into these two fields. Now, in regard to psychology, you should already know, because we've covered this earlier, that only about half of psychologists become some kind of a therapist. Most future psychologists have been psychology majors as an undergraduate. There are a few exceptions. Oftentimes, a future psychologist will have a master's degree. It takes about 2 years to do that, but not everyone who gets a doctoral degree does get the master's degree on the way. The doctoral degree, or PhD, takes about 3 years for coursework, about another year for a dissertation, and then there's a year of supervised experience called an internship, and then after graduation, an additional year of supervised experience as some sort of a fellowship. Psychiatry requires 4 years of college, of course, but not necessarily anything related to psychology or medicine. The major can be in anything as long as the future physician is careful to take the prerequisite courses for medical school. Then there's 4 years of general medical school, followed by 4 additional years of training in psychiatry as a specialty. Let's take a look now at what folks in these two fields do. Now, of those psychologists who do become therapists, of course, they will sometimes choose to perform psychotherapy. They may do psychological testing. They certainly have training in this specialty area, and they may do research as well. Psychiatrists, of course, write prescriptions for mental illnesses if that's called for. They may provide psychotherapy, and if a patient needs to be hospitalized for some good reason, they may do that. It may be interesting to you to know that most psychiatric prescriptions are not written by psychiatrists. They're usually written by family doctors, internal medicine doctors, pediatricians, OB/GYN doctors, as well as nurse practitioners and physician's assistants. But certainly psychiatrists are the lead specialists in this particular area of psychiatry. Well, that's an overview of some basic differences between psychology and psychiatry. As you already know, psychiatry is a medical specialty. It's one of many. Some other examples are cardiology, neurology, pediatrics. You've heard of all of those. As you already know, about half of psychologists are therapists, and if you want to be a therapist, you need a license as a psychologist. And the 3 branches or specialty areas in psychology that are typically licensed are clinical psychology. Traditionally, they focus on the more serious mental illnesses. Counseling psychology. Historically, they focused on problems in living, but in the real world of 2020, the differences between clinical and counseling psychology have disappeared. And then there's school psychology, and oftentimes those folks will become child psychologists. But you don't need a license to be a psychologist. You can perhaps instead just be a pure researcher. And if you think back to material that we have covered in the course earlier, developmental psychologists, cognitive psychologists, personality psychologists, the guys and ladies who build tests, educational psychology, there are a large number of psychology specialties that do not require a license, and that's because they do not provide mental health services to the public. What I've focused on in this brief video is psychology as opposed to psychiatry, two fields that are related to each other. We said that psychiatry is a specialty within medicine, and we said that psychology also has specialties as well, and the mental health professionals are clinical, counseling, and school or child psychology. I'm pleased to tell you that I'm trained as a counseling psychologist, though I have a postdoc in clinical psychology. It's good to see you today. I hope that the rest of your day goes well, and may it be a great psychology day for you. Goodbye now.